Hi everyone, it's Daryl Chung. I'm the owner of Satori Health and Wellness. We're reporting live from our location here at 418 Eglinton Avenue West. We're excited to be a part of this webinar. Our first one, our Massage at Home series here. We thought because of the COVID that's happening here and everybody's down in lockdown, that doesn't mean that you can't get a little help or release some of the stress. And so we wanted to do something to get back to the community. And today we're focusing on the neck, the shoulders, and the forearms here. Why? You know what? We want to make sure that the people that can't come to our clinic, we are open still. But I know a certain part of the population wants to stay indoors, and so that's why we wanted to provide this thing. Our mission here at Satori is we want to help as many people as possible. We want to heal as many people as possible here. And so this is one of the ways how we can reach as many people as possible during this time that we have. I'm going to introduce my two registered massage therapists. The first one is Sarah, and the other one is Victor, and they're going to be taking us through those three routines for the neck, shoulders, and forearms. So I'm going to have Sarah come online here, and she's going to describe her massage philosophy, and she's also going to talk about her style and maybe her favorite body part of massage. So welcome, Sarah.
Okay. Hello to everyone at home. I'm Sarah. I'm a registered massage therapist here at Satori Midtown. I do two types of massage. I do Swedish massage and deep tissue massage. They're also the two most popular forms of massage. Swedish massage uses long strokes and light to firm pressure to provide gentle relaxation, whereas deep tissue massage is a more forceful technique that releases tension deep into the muscles and connective tissues. My style varies depending on what the client's needs and what the client's goals are. If the goal is to relax, I use a light but firm pressure when providing the treatment. If the goal is to go deep into the muscle to break up adhesions and restore function, my style is more aggressive and forceful. It is always based around what is best for the client. My job as a massage therapist is to use the appropriate techniques and pressure to give the client the best massage for them. And when it comes to my favorite body part to massage, I probably have to go with the back because almost everyone experiences some type of tension in some area of the back and shoulders. There's so many different areas of the back that need attention, release, and relief. As well, a Swedish massage performed on the back is very relaxing, especially when it's coupled with a massage on the neck. It is always a great feeling when I can feel that a client has gone into a state of full relaxation. Thanks, Daryl.
Thank you very much, Sarah. Well, I know my back can always need a little work, so I appreciate that's one of your favorite parts. So let's get Victor come on down, and he's going to talk a little bit more about his philosophy, style, and favorite body part there. How's it going, Victor?
I'm good. Hi.
Excellent. So tell the crowd what's going on.
Victor. I'm a massage therapist here at Satori Midtown. My style, if you could call it a style of massage, is more I like to treat the root cause of the problem and not just the symptoms. I work mostly globally first, and then I hone in on whatever problem the client has. I also customize it to whatever they need. I am trained in fascial release techniques like FST. I have my fascial blade with me. Also, I do a lot of joint mobilizations, deep tissue. I can also do relaxation massage.
So what this tool, what would you use that for? This fascial?
Fascia basically is connective tissue that surrounds every part of our body. The reason why we treat it is that sometimes when there's stress, it causes a lot of restrictions and it basically pulls the body one way or the other. So basically, if you have, let's say a shoulder problem here, the pull might be either coming from the back or from your hip, and so it pulls this. And what the fascial blade does is it smooths out those restrictions so that you can open it. Yes. My favorite part of the body to treat, I like all of them. Head to toe. I don't have any.
How come you don't have a favorite spot?
Just because I go by whatever the client presents.
Okay.
And I like treating. I enjoy treating. I like making things function the way they normally do, and I like when everything flows. Yeah,
Nice.
That's basically it.
Thank you very much, Victor. Appreciate it. Just a couple of housekeeping things before we start doing our free routines. The first one is, you know what, please speak up. If you have any questions at all, please hit them into the Q&A or type something into the chat. If you can't hear us, we've got the masks on, we've got the air filtration system here. So we're all trying to be safe, so it might be a little hard. You can't see my mouth moving, so please speak up if you miss something, and we'll try to bring back to that. What else do we have? Oh yes, we also have Kobe. Kobe is our manager. She's going to be watching from distance, but she's going to be monitoring our chats and telling us how things are. Someone's saying the volume is great. Great, Sean. Perfect. Welcome BNI people. Perfect. So before we start the three routines, we got a poll. Number one, Kobe's going to pull it up here. Out of the three areas that we are working on the neck, shoulders, and then the forearms, which was causing you the most pain? And the one that's causing you the most pain, I want you to rate it between 1 and 10. 1 is no pain, 10 is you got to go to the emergency room. So I'll give you a couple of seconds there to type in your responses, and we'll see what happens there. Oh, all the responses are coming in here faster than some other folks that we've seen last month or so. Okay, so yeah, keep going. We'll give it about 5 more seconds here. We're almost done with the voting here. 5, 4, 3, 2, 1. End the polling here. And so let's share the results here. So it looks like about 60% are saying that the neck is causing the most problems. Next, followed by the shoulders at 50%. So that's I'm a little bit surprised, but maybe the massage therapists are not finding that. And the forearms about 3%.
Not surprised.
Not surprised at all. Okay. And then so we've got some we've got one person at 10 out of 10. We got one at 9, one at a couple at 8, and 7 to 6 seems to be the most popular thing. And so I think for this webinar here, the 6 or 7 is a really good spot. Correct me if I'm wrong, Sarah, Victor, but if you're like at a 9 or a 10, that's something that you should definitely get to seek additional help on that one.
Yes. So self-massage probably won't solve that problem. It's better to assess or go to your doctor first to get some diagnosis on it, and then come see us if it's just muscular related.
Okay, thank you very much. Okay, so we've got those results there. Thanks so much. I appreciate the results. That's valuable information. And now we're going to move on to contraindications. We're going to have Sarah come up here and talk about what is contraindications, what they mean, and what should you look out for.
Okay. So hi again. So when it comes to contraindications for massage or self-massage, the biggest one that you need to be aware of is if you have any pre-existing medical conditions. It's always best to consult with a physician prior to a massage or self-massage if you have any underlying physical conditions. So that's one to note. And also, if you have any open wounds, cuts, large bruises, you should not massage or self-massage over these areas. Remember that self-massage is meant to be relaxing and offer temporary relief from pain and tension. Thanks.
Okay, so we're gonna have Victor come up and talk about what are the principles of massage. Come on, Victor.
Okay, so basically, when we massage somebody, we go by the principle of general, specific, general, meaning that we basically warm up the muscle first, and then go hone in on whatever specific problem that they have, and then as a finishing touch, we basically go to general first. So general meaning that the techniques are more broad. It's more circular, like Swedish massage. And then, for example, the techniques for specific is basically trigger point techniques, fascial techniques, joint mobilization techniques, stuff like that. And then we go back to Swedish again.
Super. You just stay right there. I actually have a question, but we'll answer a question early today here.
Okay.
Everybody, if you want to put a question, make sure you drop down in the chat to panelists and attendees as well, so everybody can actually see your questions. But the first question we have here is, do people use both fascial release alongside deep tissue massage simultaneously, or is it better to pick one approach at a time?
So you can basically separate them or do them both for the treatments. Most of the time, we basically combine all of the techniques that we have in our toolbox. So I don't just use deep tissue in one treatment. So I basically use fascial to start, and then Swedish massage, and then go to more specific, and then trigger point techniques, joint mobilizations, and then some more general techniques. So yeah. But if you wanted to separate like fascial, and do like a fascial treatment, mostly we can do that as well. So it's totally possible to separate them and do them both at the same time.
What about acute and versus chronic ones?
So basically acute is usually when, if in the case of if somebody gets injured, then it's usually from a period of 1 to 3 days. There's going to be a lot of redness, swelling. There might be a lot of pain there. In terms of massage, the only thing we can really do is to decrease the swelling and move the fluids out of the area that is injured. If it's not injured, then usually it's injured. So basically the period that you would consider it being acute is if there's pain, if there's redness, if there's swelling, and then that will be. So for chronic, it's been there for a while. So usually it's like a nagging pain, like a soreness type of pain. If it involves, like, let's say, so in the case of tendonitis, it could go in a cycle, right? So if it's inflamed, then it's an acute. If it's not inflamed but it hurts, then it's a chronic. Right? So that's the difference.
Okay, great. Thanks very much, Victor. Appreciate that. So we've got one more poll, and then we're going to promise that we're going to do the first one, the neck routine here. So Kobe's going to put up poll number 2 here. When was your last massage? So please submit your answers now. Let's see how long or how short people have been doing their massages here. Okay, well, ooh, no, not bad, not bad. We got a lot of people doing 1 month. Oh, we got about 9 people doing greater than 12 months. That's been a while. Okay. Well, anyway, you know what we're highlighting here. We got. I'm going to stop the poll here. Share the results here. We're basically saying if it's been a while, come on for a massage, or this webinar is for you. So Victor, you're going to start to take us through this first routine for the neck, because it's we've got a couple more weeks left in December, so we don't want anybody to be a pain in the neck. We're going to start with the neck.
With the neck. Okay, so we're going to start with the neck.
So what do you want me to do first?
Okay, so basically, should I show? So you're going to put your hands up.
Yeah.
90 degrees, like that, and then you're going to put it to as close to the spine, to the side of the spine as you are, on the base of your skull.
So everybody, you guys, come on, follow along here, do the same thing. This looks like I call it the moose antlers. So, okay.
Yeah, and so basically we're going with the general technique. So it's basically a release and hold. So you're gonna push up into the base of your skull.
Okay.
Try
Can I press my
not
head
to
like this?
try not to bend your thumbs.
Okay.
Like do it with like a relaxed hand. Take some deep breaths. The pressure doesn't have to be that much. The tissue is able to relax more if the touch is more relaxed.
And so I'm moving down toward my ears,
Yes,
like a J here.
yes, but you're stabbing yourself, so
Oh.
don't stab yourself. There you go. Yep, and then that's it. And so after a couple of breaths and after maybe 3-4 times that you do that,
Oh, I forgot the breathing. We gotta make sure we're breathing here,
Yeah, you
guys.
gotta
This is
go
supposed to
breathing.
be relaxing at the same time.
diaphragmatic
Yeah.
breathing is very important.
Breathing through the belly. Okay.
Breathe to the belly. And so we're gonna stop, and so we're gonna go to the specific one. So it's the same thing. Daryl's just gonna shake his hands out for now because sometimes it's tiring. So for the specific one, we're gonna do some circles. So
Can I put my fingers on my skull here while I do this?
you can, as long as your fingers and your hands are more relaxed. Like it's one thing to relax the neck, and then your fingers are all crooked.
Okay. So nice and relaxed.
Yeah, so you're gonna go outside to the outside, just behind the ear.
So the circles are from going to the outside as
Going to
opposed to
the
inside.
It
It doesn't
can
really
actually-
matter.
It can actually go in, but like whatever you prefer it, as long as you take deep breaths and feel the muscle or feel the tissue relax under your thumb. And that's it. So we're gonna do another specific one.
Yeah.
What we're gonna do is so what we're gonna do is we're going to actually we're gonna go back to general. So what we're gonna do is we're gonna press to the side again, to the side of the skull again.
Like this?
Yep.
Okay.
Right? And then you're just going to press, hold, take a deep breath, and then relax. There we go. More. And relax and go to the outside. And relax. And more.
Well, I gotta relax these arms. I get a little too.
Yeah, I told you.
I don't know how you guys do this 5 times a day.
Well, we got strong forearms. And just go back to the center.
And so we don't want to press more than a 7 out of 10. Is that right?
For this one, I would say 4 or 5.
Gotcha. Okay,
There's
so-
not really a lot of tissue at the base of the skull. It's all like tendons. And we don't really want to stab the back of our head.
Gotcha.
There you go. And that's it. That's
Okay.
it for the neck. Woo.
What's next?
Oh, so the next one is we're gonna be doing the shoulders.
Okay.
So for the shoulders,
Is he sitting?
Hmm?
Sitting, understanding.
And we're gonna be standing on this one.
we're gonna be standing, I guess. So for the shoulders, like Daryl, if you could just turn around, you're gonna grab the opposite shoulders, right? So you're gonna have your palm flat, like this,
Okay.
right? And then what you're gonna basically do is grab the tissue and then pull up. So you're lifting
Pull
the
up like
tissue,
this.
yes, like that. So if you turn around,
So using the fleshy part of your
yes.
palm to capture most of the
Mhm.
muscle there instead of your fingertips.
So you're actually gonna go up to the base of the skull. So it's sort of like a combination of like shoulders and neck, because some of the shoulder muscles go up to the neck.
Someone said, can you do this lying down, actually? Iris was talking about this when you're doing the neck part.
You can actually do it lying down. Sometimes because we're standing up or sitting down, the muscles are activated. So you just have to be careful, like how hard you press when you're lying down. And that's probably it. But the more relaxed the muscle is, the more you can grab, and the more it'll it'll give up.
So hopefully everybody's following along here, getting their massage. Here, someone was asking, is it better to stand or sit while you're doing some of these?
Sitting is probably better. Just be aware of your posture. You don't really want to slouch when you're doing self-massage, because then it basically negates the treatment. Okay, and so that's the general part of the shoulders.
Okay.
So what we're going to do is the specific one now. So there's two of them. So one is you're just going to, it's going to be the same arm, opposite shoulder. You're going to squeeze and then shake across.
Shake.
Yeah, back and forth.
Back and forth. Not like
Not like that,
this.
because the muscle fibers go that.
Okay.
So basically.
So I kind of
like that.
break up the muscle.
So you're
fibers.
gonna go up to the neck right
Okay.
here. So you can grab, make sure that you don't put a lot of pressure because there's veins there you don't want to pass out. There you go. And
Okay.
grab and then shake. And you do that maybe 3-4 times. Go back up, make sure you breathe.
Some people can feel some of these massage techniques here.
Yeah. There you go. And we're done.
Okay.
Okay.
You can also do it underneath your shirt. I'm just
Yeah,
doing
you
for
can.
demonstration purposes over, but you can also go right onto the
Mhm.
skin there, right?
Just make sure that maybe use like an oil or a lotion.
What type of oil? So not everybody has a massage oil. So what,
Actually, any oil would work as long as they have a glide.
so any cooking oil,
Yeah, cooking oil,
Virgin
olive oil,
extra virgin?
yeah,
olive
coconut oil, olive oil, grapeseed oil. You can even use canola oil. Just as long as you don't have any allergies to it.
Super. Yeah, in a moment, you guys want, if you want to run to your kitchen and grab some oil, that might be useful actually when we're doing the forearms here. It's not necessary you have it, but it could be helpful.
Yeah, you can also do an extra one for the neck if you have oil, where you just rub up and down, and that'll be your general.
Oh, nice. Okay.
Yeah.
Cool. Anything left for the shoulder here?
For the shoulder, no, I think we're just gonna go back to general. So what you're gonna do?
General was this.
Yeah.
Okay.
General was that, and then if you want, you can just squeeze a little bit and relax it some more.
Using with the fleshy part of your
The fleshy part of your palm. So again, the pressure for this one is generally 4 or 5. Like you don't really want to use a lot of force. It's just enough so that the muscle relaxes under your hand. And that's it.
Super. So we're gonna let everybody do your opposite shoulder. We're not gonna have time to actually work on it, but that's your homework actually to
Yeah,
do.
that's the
Or while we
general-
have some in between time during our Q&A section later on to tonight. So you got a few options to work on the opposite part there.
Mhm.
Okay, so Victor, I wanted to ask one more question. I remember, just to wrap up the neck and the shoulders here, it's not necessarily, if you have a pain in the neck, it's not necessarily caused by the neck. Because I just had a massage with Victor just yesterday. You spent almost an entire hour almost on my hips.
Mhm.
And I was working after an hour later that after the hips, I think you helped with alignment there, that I had less neck problem.
Yeah. So everything is basically connected. Like it basically goes from bottom up, right? From the foot up to your neck.
You come on here and talk to them about that.
So I've had some clients, for example, who doesn't wear heels a lot of the time, and the one time when they do, they would feel their neck being tense because they've been wearing heels or they've been on their toes for maybe like 4 or 5 hours or whatever, and that's probably the thing. There's also something called referral pain, right? So it's basically caused by trigger points or knots in normal terms. They also refer pain for people who have like headaches, like tension headaches. So the most common one would be on the side of your head, and that usually comes from the trapes, right? So if you have a tension headache and it settles on the side, then it'll be from the traps, and then it goes like certain muscles refer pain to a specific area, and vice versa.
Super.
Yeah.
Okay, so now we're going to move on to the forearms. In just a moment, go practice your techniques on your opposite shoulder. There's also a question actually, when you're working on the neck part, should we be looking up, looking down? What should be?
Oh, so your neck should be neutral. So like I'll let Daryl demonstrate.
Okay.
So like let's say you're sitting down, so you're going to jut your neck up forward like that, and then tilt your head a little bit, like so. Yeah. So basically, this is where a lot of people have problems. And then if they're reading down, then you're gonna tuck your chin and then jut your neck out, and basically that causes all of these muscles to tense up.
Yeah.
All of these muscles to tense up, and then usually sometimes it causes headaches and like compensatory structures being compromised. So the best way to have a neutral neck is you're gonna set your shoulders. So you're gonna go back,
shoulders back,
and then down, right?
Oh.
And then instead of pulling your shoulders, pulling your neck forward,
yeah,
you're gonna pull your neck back and relax the chin.
What,
right?
are you trying to make me a double chin?
And then so instead of using your neck to look down, you're just gonna tilt your chin a little bit and then relax.
Relax.
And that's where you should be.
Very military standing.
Okay. So
very military.
But it doesn't necessarily have to be that.
Yeah.
Okay. Cool.
Right. Yeah. There you go. But like generally, that's where you should.
Okay. So not so much like this when you're at the monitor. I know a lot of people do it, so we need to pull that back every so often. So we'll do that.
Yeah.
Okay. So the camera's going to move for a second because we're going to have to lower it down. So don't be alarmed. Or look away so you don't get dizzy about this. I'm going to move this down. Hey guys, we're getting up close and personal here. Okay, so make sure you have a level surface. You got a cloth because during our practice session we had massage oil all over the seat here, so that's not necessarily a good thing. And if you haven't, you have an opportunity to rush over, get some of your cooking oil. You don't need too much of that. And we're ready to go to do the forearms.
Okay, great. So I've had a lot of clients actually come in over the past few months, and they have been complaining about tight forearms, tight hands. They've been working at computers and using the mouse a lot, repetitive action. So I guess it was my idea to show you a simple 5-minute forearm self-massage forearm routine that you can do at home if you're in that boat and experiencing these problems. So what I'm going to have Daryl do is we're going to start with step 1, which is going to be to warm up the area. So what he's going to do is he's going to grab his lotion, oil, whatever you have as a lubricant that you can use, because you want to make sure that you're using something that can provide a nice glide. So Daryl, now you're going to be wanting to warm up the area, both front and back. Make sure. And yes, you're doing a really good job there, actually rotating your arm into the other hand.
Come on, guys, everybody follow along here.
Yeah.
It is nice. And
yeah, great.
You know, it's not just relaxing, it's actually reconnecting with the body. So
yeah.
It's nice to do that.
Yeah, the forearm for sure. It can be it's meant to be relaxing. Self-massage is meant to be relaxing and allowing you some temporary relief from pain and discomfort, either in between treatments or when you don't have a chance to get into the clinic. This is a great way just to help your body relax on your own.
We got some extra oil.
No, it's okay. You know what? Not to worry. sometimes a little extra lubricant is better because you want to make sure that you're gliding over the skin.
Okay.
And what? Yeah.
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 Victor seems to like it too.
Yeah. Excellent. So now once you've warmed up the area, everyone's laughing.
We're having too much fun.
I don't know what's going on. So once you've warmed up the area, and I feel like Daryl's done a pretty good job warming up his forearm there. He's used all the kind of proper techniques. He's really he's using his other arm too to work through it. Yeah, just rotating. Show people how you rotate your arm into it again. Yeah, that's great. That's a great one to do because really you're able to get access to the whole forearm at the same time. Okay, so now you're fully warm. We can move on to the next step, which is to squeeze the tissue, squeeze the muscles.
Squeeze the muscle.
Yeah,
okay.
so you're gonna, you can start, up and down, squeezing, and then back and down, and you're gonna wanna hit both sides as well.
Flip it over, okay.
Now, if you find that when you're squeezing that you have an extra painful spot, in those extra painful spots, you're gonna wanna squeeze a little bit longer and hold.
Super. Is there anybody in the chat saying anything about those painful points?
Hi. Where am I looking? I guess I don't think so.
Okay.
I think I'm just waiting on. I can see it pop up here, so I'm waiting to see if I get any questions or anything. So yeah, so you want to anywhere where you feel like you have more of a tense or painful area, you can just squeeze and hold. Yeah, and then wait for you should start to feel a little bit of a release in some of those areas.
Yeah. Gets a little slippery here, just holding down.
Yeah, great.
Oh,
good.
Just a sore spot right over here.
Yeah, good.
Oh, yeah.
Yeah, so squeeze and hold areas of greater tension for extra relief. So that's kind of the key point to take away from that step when it comes to squeezing the muscles. And now the next step you can move on towards, if you're ready, Daryl, is you're going to be to knead the muscle.
Okay.
So kneading can be applied using a fist, a hand, fingers, or a thumb, whatever works the best for you. In massage therapy, kneading is a circular technique where tissues are lifted, rolled, and squeezed. So you knead the muscles in a circular motion with downward pressure.
How's that look?
Yeah. So yeah, that looks good. You can go a little bit slower too. You can really just to try to get in. Sometimes with a fist, it's maybe a little harder to knead.
I'm a little nervous because I don't do this every day, so I'm a little tense actually.
You should. Well, yeah, just you want to relax. This is meant to be relaxing, so don't. At the end of the day, as long as you're being safe, you can't really self massage wrong. You have to, as long as you're paying attention not to hurt yourself in any way, just using the right amount of pressure to get into the muscles, then you should be doing the self massage correctly. Great. And then maybe you can just try with a thumb maybe to knead as well to get in. Yeah.
Something like that.
Yeah. And as well with this technique, you can also use like with the warm up, you can use the arm that you're working on to actually rotate away. To get into there. Just to get in a little bit better. Yeah.
Okay.
Yeah.
All these secrets you're learning.
Yeah. You can use your arm that you're working on as a way to help.
It's a lot of coordination.
It is. If the coordination's a little too much for you, then you can just stick to circular motions. But that's just more of a.
I'm a guy. I can't multitask.
Yeah. So you can just move back to just move back to your regular kneading circles, and that's fine. But that's always.
I can handle this.
Yeah. So you should start to be feeling relaxed, and we want you to be relaxed.
Okay.
Okay, great. Kneading into any of those really sore spots that you have. Yeah, good. And you actually, you know what, Daryl? Right now you have a closed fist. You should actually probably have your hand open because what you're doing by closing your fist is any of those muscles in the hand, like you're tensing them up rather than. Yeah. So yeah, I know because it's we're on camera. Everyone's a little bit nervous here, but you want to be relaxed when we're doing this. So
I'm nervous because I got two armed teeth looking at me. I feel like I'm doing it wrong. Here.
No, you know what? It's a work in progress. But at the end of the day, if you feel like you're getting into the tissue and the muscle, then you're doing it right. So
okay,
just
thanks, Sarah.
There's
So
no
don't
need.
be nervous, guys.
No need to be
camera.
nervous. No, this is meant to be a relaxing thing that you can do at home. So good, Daryl. You've done a really good job on both sides.
Thank you very much, Sarah.
Yeah. You just shake it out if you need a little bit of a break. I know it's this can all be done slowly too. You don't have to go as fast as Daryl was doing. You can go slower and take your time.
But we're not done yet.
Yeah, we're not.
Right? What's the next part?
No, we still have 2 more steps that you can do in this massage routine. So the fourth one is going to be muscle stripping. Okay. So muscle stripping is a deep massage technique that targets a specific band of fibers and applies pressure directly from the origin to the insertion of the muscle. So for simplicity, for self-massage of the forearm, muscle stripping should be started around the area of the elbow or elbow crease.
Okay.
Yeah, and you're moving distally towards the hand. Okay.
Distally towards the hand.
Yeah.
So I'm going to take that as moving towards the hand here.
Yeah. So moving towards the hand with your hand open, because you're going to be able to actually relax the hand at the same time. If you're starting up at the elbow and moving down and taking your time. Now I can see that you're getting a little bit red there, Daryl. It's probably because you don't have enough lotion or oil or lubricant on. So right now what you're doing is you're going to see that Daryl's getting a little bit red there in his forearm. And do you find that there's a burning sensation without the lubricant?
Yeah, a little bit of friction there.
So that sensation is actually the fascia. The fascia that you're so without the lubricant, you're getting red there because you're actually moving the fascia around. So that is something like it's also something that you can do, but it doesn't feel as relaxing, and so lubricant is always the best way to go.
I feel like I'm steamrolling here, like
in order to glide along the skin.
We used to play this thing called Yellow Brick Road back in the 80s, and to make some pain for the forearms,
so Daryl's going a little bit fast when he's doing the muscle stripping. He can go a little bit slower.
Okay.
And also the pressure that he wants to be using is probably around a 4 or a 5 as well. We don't want to use too much. We just want to get into the muscle across the fibers and strip it down. And if you're doing it slowly and deliberately, you should actually start to feel your hand relax, and then the fingers start to open if you're stripping. Yeah, so I can see that your hand was a little bit curled up, and it's actually now starting to
Well, I don't give you guys enough credit, because this is actually a lot of work to self-massage, actually. You gotta focus on so many things and be intentional, as you were talking about.
But as you do it more and more, you become more comfortable with it, and eventually it's like second nature. If that's
So we can do this as a kind of a daily routine.
If you wanted, if you're really experiencing pain in your forearms, or your neck or your shoulder, you can use these techniques all the time. You don't have to use them step by step or as the routine is. You can use them individually. Just the key point to take away is you always want to warm up that area prior to using any of the specific techniques.
So it sounds like those 9 people who haven't had a massage in 12 months or more, this is something, I think this is a daily routine that you can actually do nice and safely, and I think it would be beneficial.
How are you doing there, Daryl? You're still focused? You're focused in on your self-massage?
Okay, you got it.
Yeah.
Okay, I'm focusing on there.
Yeah, it's okay. I know it's a lot to take in, but you've done a great job, and I think that you can probably just shake it out for a second. Yeah, there we go. Yeah. Ooh, yeah. We're getting in our workouts today with the self-massage. The final thing that we're going to move on to is the trigger point. Okay.
Oh, yes.
So I think Victor had spoke to it previously, but I'll just explain it a little bit more again. So with the trigger point, what a trigger point is, it's a hyper-irritable spot in the muscle, and it refers pain. So the pain refers in a pattern. Chances are, if you are on a painful spot, you feel the pain radiating, you're on a trigger point.
Okay.
Trigger point release can help relieve pain and also improve decreased range of motion. Also, it should be noted that trigger point release is a great way to manage pain in hyper-irritable muscles, and offers relief until you're able to get in to see a massage therapist for a full treatment. So I don't know, Daryl, if you've been able to locate any trigger points in your forearm. There's many that are in the forearm, and that's a good one right there. But what you want to do is before you get right into that trigger point, I just want you to go and just find it first, you know, just find it. And when you think you found it, yeah, you're just gonna settle in your thumb into that spot.
Yeah.
Well, with a flat thumb, so you're not putting in too much
Okay,
pressure.
so not this, but a flat thumb
yeah,
here.
the flat thumb, so that the pressure is dispersed. That the pressure is dispersed better, and you're not putting too much pressure also on your joints, like of the other hand that you're using to massage.
Gotcha.
Yeah.
And so I'm starting to feel a little tension here. What's the level here out of 10? Is it we should be aiming for no more than a 7 out of 10?
Yeah, a 7 out of 10. So well, yeah, you know what? Generally, trigger point treatment, you do have to apply pressure, but when you're doing it with a self massage, you just want to apply enough pressure so that you feel that trigger point kind of engage, and then you're going to want to hold it until up to 10 seconds, or until you just feel the pressure of your thumb remaining on that spot. So then you'll know that the trigger point's been released. And if it doesn't happen the first time, you can repeat this up to 3 or 4 times until you get the desired result.
Okay.
So once you've held it now, okay, so you just shake it out for a second, shake it out, and then we'll do it again. Okay, so
Woo!
yeah, you're
You want me to do it again?
one more time. Yeah, just
One more time.
some
Same
people,
spot or a different spot?
No, you can use the same spot. You can use the same spot more than once. That's fine.
Oh,
To really treat it. Yeah, and
this
then
one I have to go a little deeper.
yeah, you find it.
Oh, straight thumbing on the 2.
Yeah. There you go. And now find it, hold it, kind of engage with that trigger point, and apply the pressure, the steady, firm pressure.
Breathing, guys.
Yeah.
Everybody breathing too.
And then until you feel the release or the pressure. It's just
It actually did go away.
Yeah. So then you know that you've treated that trigger point, so you can now release it.
Wow. Okay.
And what you're gonna do after that is you're just gonna kind of rub that area just a bit, just to to smooth it out. And then finally, for trigger point treatment, the best thing to do afterwards is to do a stretch. So a stretch for that is you're going to,
okay.
You're right, and then hold. And the stretch can be held until you feel the release, or up to 30 seconds, whichever one comes first.
Okay.
Yeah.
Perfect.
Yeah. And then at the end, now you've kind of finished your routine. You're just going to cool down, so you start with back to step 1, which is general. But we're doing general, or like warm down the area.
Smooth it out.
Perfect. And then when you feel like that's done, shake it out, and away you go. Yeah.
Thanks so much, Sarah.
You're welcome, Daryl. My pleasure.
Perfect. Okay, we're going to move back. So the camera's going to move a little bit here. Here we go. Hi, everybody. Let's put that down here. Okay, someone's got to have a request here to kind of do a quick recap. During the Q&A, we'll do a quick recap of all the 3 routines, just quickly, spend 20 or 30 seconds for each one, and then we can do that. Let's make sure here. Do you do it with your knuckles or the flat part of your fingers?
For which?
I think when you're doing the forearms here.
You can use any. You can use
your knuckles or the fingers, right?
Or fingers, thumb, whatever works, whatever body part that you're able to use in order to get into that muscle or the tissue. It's fine. It's fine. You don't have. It doesn't have to be one or the other. It can be all of them. You can just use them separately, but all for the same technique. So not to stress too much about that.
Okay.
Yeah.
So we finish off with the forearm here. Now we're going to close off, but we want to go into the question and answer section here to see if there's any other questions here. So we're going to have Victor and Sarah come onto the screen here, and if there's any questions here, let's see what they can answer here. Oh, we can have Victor come up, and you can be in the background. You've been doing a lot of talking, Sarah. So if there's any questions, set us up. And while we're waiting for some questions, why does my trigger point keep on moving?
The trigger point actually moves through the muscle belly. So what you have to do is you just have to pin it down. So basically the best way to do it is to sort of negotiate with it. Like don't put too much pressure, and then when you pin it, then you just press on, and then it won't move. Also, sometimes the movement is when it actually releases, right? So if you find that it feels like it's dissolving, or lessening in pressure, just keep at it until it dissipates into being not painful anymore.
Super. Other questions that are popping up? How about can you give us a quick recap of the neck and the shoulder routine? Someone was asking.
Oh yeah. So what you're gonna do for the neck first is the general. So what you're gonna do is you're gonna go to the back, to the base of the skull, press up and hold. Take a deep breath, and then move up.
We're going to all have handouts that you guys can access a little bit later on too, so not to worry that if you forgot something, we're going to come back to it. You also have the video, but yeah, keep on continuing with the.
Oh yeah, so after that, we're going to go with the circles going outwards, so it's the same place in the middle of the base of the skull, beside the spine. You're just going to go push up, and then you're going to go outwards, and then towards the behind the ear, and then you can go back. And then do that maybe 3-4 times. And then you're just gonna go to general again. And it'll just be, you press up, hold, take a deep breath at a slower pace this time. And then you just finish up that.
Okay, and for the shoulders?
For shoulders, it's basically you're gonna rub up and down to warm up. You're gonna have your palm flat. You're gonna grab the muscle tissue, squeeze and pull up, and then release. And then you just do that up and down, up to the base of the neck. Three, 4 times. And then we're going to go move on to a specific, which is, it's going to be the same, but now you're going to shake back and forth the muscle belly. So you're going to go up, hold, shake, up, hold, shake. And then you can grab the neck.
Nice.
And then you're going to go back to general, which is pressing. And then as a little extra, you can just squeeze to just relax.
This is your homework for the other side. If you haven't done the other side, this is a perfect time to do question and answer.
Yeah,
the other
there
side of the shoulders. And so how about the forearm? Or are you all done for that?
I am done. Yeah.
And do you want to do a quick recap of the forearms?
Oh yeah, sure. I guess we can. I guess I need we can try to do this. There we go. How are they going to see me? All right, you're not going to be able to see me very well. So.
I'll leave it up.
Yeah, it's okay.
So give us a really 30-second recap on this part.
30-second recap. Okay, so what you're gonna do, you're gonna apply some lubricant to your hands. You just don't have to apply it to one hand, not for whatever. So you're gonna warm up the area, warm it up. You don't have to use your other arm to move if you don't want to. You can just keep it straight on. Then next to what you're gonna do is you're gonna squeeze. You're gonna squeeze the muscle.
Perfect.
Squeeze, 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 squeeze. And then any of those extra painful spots, you're gonna squeeze and hold. And wait for some release. Squeeze, squeeze. And once you're done that, you can go on to kneading. You can use once again, your fist or your thumb. I like to use a thumb. Yeah. There we go. I guess I'm enjoying this as I'm doing it to myself. So that's probably why I'm taking a little bit extra time and getting a full 5-minute routine again now because I'm enjoying what I'm doing. And then their fourth step's gonna be muscle stripping. So you can see that I'm actually getting red here. It means that there's blood flow to the area. So yeah, muscle stripping.
Super.
Hands open. Yeah. The angle I'm on right now is okay. but I would prefer like maybe a flutter service, but that's all right. And then step 4 is trigger points. So I'm gonna go find a trigger point, hyper-irritable spot in the body. Let's go in. Okay, found it. Flat. Hold. Wait for the release. Feel the release. Rub it down. Stretch it out.
Super.
Okay.
Thanks very much, Sarah.
You're welcome.
Well done. Good review there.
Okay.
We do have a question or two for our RMTs here. What's the best part of the neck to massage to relieve migraine attack?
For migraines, it's not necessarily like a muscle thing. Migraine is mostly caused by hypersensitive nerve,
Okay.
right? So it's best to know what triggers the migraines, and usually do what gets it better. Sometimes you have to turn off the light, sometimes you have to just lay down. Yeah, like sometimes you can just rub your temples.
Right up here, yeah. Okay.
Yeah, like the one trick that I learned was that if you put a cold towel on your shoulder, right, it slows down the nerve conduction going to the head. So it might decrease your migraines. But again, do it cautiously, because migraines they have different triggers.
Yeah. I also heard that if you drink like 3 or more cups of coffee a day, that increases your chances of migraine by 50%.
Yes, that's because your heart's it's a whole other ballgame.
Well, Iris, and I just want to say this is a feedback here. Iris was talking about, also using a tennis ball on the forearm. You can use a tennis ball and a stocking and use it on your neck. So some good ideas actually.
Yep.
Thank you very much, Iris. We appreciate that. Okay, so we're going to finish off here. I know we got a prize. We're going to give away a 30-minute massage. So I know you guys are looking forward to that. So we did our drum roll. So please type in, if you're still there, you're interested in the massage, type in the word self-care into the chat, and then Colby's going to tabulate the results and pick by random one of the winners. So type in self-care right now, and you'll have a chance to win that 30-minute massage at Satori. While you're doing that, I'm going to talk about our next series. We're trying to aim for a monthly webinar that's happening back in January. The next one's going to happen in January, probably January 14th. We're working on it. We're trying to get our osteopath to talk about maybe some jaw problems, the TMJ thing. So stay tuned for that. We've got your email. We'll send you an update on that. Don't worry about this. A video is going to be here, so you're going to have copy of this, or hopefully we can break it out into the 3 routines so it's easier to manage. And you know what, we're also going to create a handout for each 3 for the neck, shoulder, and forearms. So you can also have it by paper as well. Now everybody's typing in their self-care. I love to, Victor and Sarah have been working over the last couple of weeks on this. If you want to type your thanks into the chat, it's so much appreciated. They have done tremendous work here. I really think you guys have been awesome today. Thanks for staying late tonight to do that. I forgot to do the polling, but we'll check that in a little bit. But I want to let you know the availability of the therapist. So, Sarah is available for most days of the week here. She lives close by, so she can always pop on by. Victor is working on Mondays, Wednesdays, and Saturdays. So if you need, so we've got some good availability next week. This week, we only have like 1 spot left. So next week, we got some better availability. If you have insurance and it's running out by the end of the month, definitely a good time to come in and try it out, because Victor and Sarah are standing by for that. Let's see what else is going on here. Oh well, I think we're almost ready. I'm not sure, Kobe. Tell me if you're ready to give the results for who's our winner. We can figure that out in a moment. Everybody's sending a lot of thank you, guys. Thank you for a great video to Sarah and Victor. That's perfect. Oh, so Jody Goldfinger is the winner of the 30-minute massage. So well done. Oh gosh, go Jody. We'll see. It sounds like we're going to be seeing you soon.
That's funny.
How, she's got all the luck there. Anyway, almost 9 o'clock. I don't want to keep everybody waiting here because you guys you got your homework to do. You got to work on the shoulders and you got to work on your other part of your forearms there. But I want to leave you with a quote that I have from Rumi, and he's a Sufi poet, and this is what he said. Yesterday I was clever and I wanted to change the world. Today I am wise, so I'm going to change myself. So let's change the body first. And when you change the body first, your own body first, then you go out and change the world. Okay, guys, we'll see you at our next one next month. Take care.